Well, every Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic. We're talking about lung cancer, and it's very appropriate to talk about it today because today is
the Great American Smokeout.
All right, so first of all, what exactly is lung cancer?
Lung cancer is a cancer, of course, and defining a cancer, it has three characteristics. Number one, it grows without limit. Number two, the cancer cells lose their ability to do what they were designed for. So a cancer of the eye, you can't see. A lung cancer will not transmit the oxygen from the air into the blood so that you can breathe for the rest of your body. And the third is metastasis, which means that some of those cancer cells can shear off and go somewhere else in the body and set up shop, and you can have other cancers of the lung in places like the bone, in places like the liver, in places like the brain.
And how many new cases of lung cancer are reported every year?
Christine, more than 170,000 cases a year are diagnosed in the United States. It is the most common cancer killer, both in the United States and in Hawaii. But the really important part about that is it is preventable.
Okay, and what are the risk factors?
The risk factors have to do with smoking. And if you smoke already, this is a good chance to stop with the Great American Smokeout. Talking to the Tobacco Quit line is another way. Talking to your doctor is another way. But basically, it will make a difference if you stop in terms of risk. The risk factors of cancer of the lung include smoking cigarettes, cigars, pipes, chewing tobacco, and vaping, which is new, but it's a risk factor for lung cancer.
And some people don't even smoke, and they could be at risk due to secondhand smoke?
Secondhand smoke. Both my parents didn't know the risk when I was growing up, so both my parents were chain smokers as I was a child, and that's a major risk for lung cancer. In addition to that, air pollution, family history of cancer, and age are risk factors as well.
And what are some of the signs and symptoms to look out for?
A cough that doesn't stop, especially a cough where you're coughing up blood intermittently, is a risk, is a sign. Unexplained weight loss, fatigue. Other signs include shortness of breath, wheezing, chest pain, loss of appetite, and even hoarseness because it affects the breathing tubes.
So if your voice starts to change and sound a little raspy or deeper?
Right.
Okay. And how is lung cancer diagnosed?
You go to your doctor. A history and physical is the important part of diagnosis, and then a chest x-ray and especially a CAT scan of the chest is important, and finally a biopsy for diagnosis of those cells. As a matter of fact, a preventive, a screening test for lung cancer in smokers or recently quit smokers is that CAT scan, low-dose CAT scan of the chest.
And if you are diagnosed with lung cancer, what are some of the treatments available?
Well, first of all, again, stopping smoking is very important. The surgery that's done on stage 1, certain types of lung cancers, stage 1 can be curative. So rather than a death, you're dealing with a cure, and that's very important. In addition to that, there's chemotherapy, radiation, and targeted therapy like immunotherapy.
Okay. And how do you prevent lung cancer aside from quitting smoking?
Quitting smoking is it.
Okay.
The Tobacco Quit line, the Great American Smokeout, talking to people who have quit smoking, those are very important.
Okay, in our next half hour, we are going to give people out there some tips on how to quit smoking. It is the Great American Smokeout today. Next week is Thanksgiving, so we got the day off. What are you coming back with in 2 weeks?
Another preventable cancer, colon cancer in 2 weeks.
Okay, well, thank you very much, Doctor, and have a happy Thanksgiving.
You too.
Thank you, Doctor.